Families who lost loved ones will have noticed that the Secretary of State, in his opening remarks, did not respond to any of the specific allegations from yesterday. Allegations which are grave and serious, that the Prime Minister is unfit for office, that his inaction meant tens of thousands needlessly died, allegations from Dominic Cummings that he specifically is accused of misleading colleagues, an allegation from Mr Cummings, Mr Speaker, on our preparedness and lack of protection for people in care homes. Now, these allegations from Cummings are either true, and if so, the Secretary of State potentially stands in breach of the Ministerial Code and the Nolan Principles, or they are false, and the Prime Minister brought a fantasist and a liar into the heart of Downing Street. Which is it? Families who have lost loved ones deserve full answers from him today. Is he ashamed that he promised a protective shield around care homes and over 30,000 care home residents have died? Why were 25,000 elderly people discharged from hospitals into care homes without any test? Did he tell Downing Street in March that people discharged from hospital had been tested, even though it wasn't until 15th of April that there was a requirement for testing to take place? In public, he has often claimed that little was known of asymptomatic transmission at the time, so testing wasn't necessary. But Sage in January flagged evidence of asymptomatic transmission. A study in The Lancet in February flagged it. On March the 5th, the CMO said there may well be a lot of people who are infected and have no symptoms. So why didn't he insist on a precautionary approach and test all going into care homes? On 6th of May at the dispatch box, he claimed that it is safer for them to go into a care home. 12,000 people had died in these early months. How could he justify that comment? In April, he told the House that what is important is that infection control procedures are in place in that care home. But care homes, like the NHS, struggled with the most desperate of PPE shortages. And he was telling us in March from this dispatch box that supplies were extensive, but apparently in private in Downing Street was blaming Simon Stevens for lack of PPE. But the reality is him and his department was responsible for PPE, and the NAO report said the supplies were inadequate. 850 healthcare workers died. How many could have been saved had they had PPE? Families loved lost ones and have been let down by this government, this Prime Minister and this Health Secretary. But the truth matters. These families and the country deserve clear answers from the Health Secretary and the Prime Minister today.
Secretary of State.
Thank you, Mr Speaker. These allegations that were put yesterday and repeated by the Right Honourable Gentleman are serious allegations, and I welcome the opportunity to come to the House to put formally on the record that these unsubstantiated allegations around honesty are not true, and that I've been straight with people in public and in private throughout. Every day since I began working on the response to this pandemic last January, I've got up each morning and asked, what must I do to protect life? That is the job of a health secretary in a pandemic. We've taken an approach of openness, transparency, and explanation of both what we know and of what we don't know. I was looking at it this morning. Since last January, I've attended this House, Mr Speaker, over 60 times. With the Prime Minister, we have together hosted 84 press conferences. I've answered 2,667 contributions to this House and answered questions from colleagues, the media and the public. And we'll keep on with this spirit of openness and transparency throughout. As well as coming to the House today, I'll be answering questions and hosting another press conference later. Now, sometimes what we've had to say hasn't been easy. We've had to level with people when it's been tough, when things have been going in the wrong direction. And also, we have learned throughout. We've applied that learning both to tackling this pandemic and making sure that we're as well prepared in the future as possible. But beyond all this, what matters remains the same. Getting vaccinated, getting tested, delivering for our country, overcoming this disease and saving lives. And that is what matters to the British people.